Hi everyone, my name is Monique Onokwachere, and today I am at Evercare Health Facility, Lekki Phase 1, and I'm here to talk about my experience at Evercare Lekki. So I started using Evercare Lekki last year, October 2022, when in the middle, I think that was October 1st, in the middle of the night, I woke up and I couldn't breathe, and I called a doctor friend of mine who told me to rush down to Evercare to get treatment immediately because I would not be able to go to his hospital. Fast forward to 2023, same September. So apparently this was where my daughter was born, okay? And my daughter came early at 28 weeks. Too early, nobody expected that. And then she was moved straight into the NICU of Evercare.
My name is Dr. Igwe Arobasi. I am a consultant pediatric and minimal access surgeon at Evercare. I and the team of cardiothoracic surgeons, Dr. Sanusi, were called to see Zoey. Zoey was being managed for prematurity, was born at the 28 weeks of life. It was also noted after several investigations by the neonatologist and the pediatric cardiologist, who discovered she had what they call Patent Ductus Arteriosus. It simply means that there's an abnormal connection between the blood vessel, two big blood vessels, one that takes blood from the heart to the lungs, and the one that takes blood from the heart to the entire body. So it simply means there is an abnormal connection between the right heart and the left heart.
I'm Dr. Lekmil, the consultant pediatric and neonatal intensivist, Evercare Hospital Lekki. The journey of baby Zoey was exciting and challenging throughout a period of about 2 months, from respiratory distress and its management to cardiac failure and PDA closure. Also, baby had gone through a renal failure, which warranted a use of peritoneal dialysis.
Dr. Berry had, spoken to me, explained, and Dr. Lakmi as well has explained that my month's baby would have to do surgery. From peritoneal dialysis again, surgery. Just imagine like being told as a parent these things, and you're talking about days. Once you're doing this, you need to finish doing that because blood needs to go through all our organs and all of that. And then the team went back, like I always say, the team of doctors, and then they came the next day to tell me they were not going to be opening either. They were going to be going in with a camera. Now they would just puncture 3 holes and they would go in, clip it, and it's going to be fine.
My name is Dr. Bere Awo. I'm a pediatrician and critical care physician. I work at Evercare Hospital, Lekki, Lagos, Nigeria. Baby Zoey had a major complication, which is expected for a child who has been on oxygen for more than 30 days. Zoey was on oxygen for about 50 days, and we had bronchopulmonary dysplasia, for which she was about going to be discharged on oxygen. However, we gave her some trial of medications for which she eventually was weaned off oxygen.
When she came and she told me the surgery was successful and they are, trying to wrap her up, take her back to NICU, I was so grateful to God that once again she was at this facility where everything, I don't know if there's some things they don't do here, but at least concerning my experience, everything was done here. And then 2 hours later, I saw my little angel, my Zoey, and she was taken off ventilator, and she didn't even bleed. Dr. Aura, your hands are blessed. She didn't even bleed. Like there was no, like the tube, there was nothing to drain. Like these doctors, they're not joking, man. They're not joking. They sabi the work. They sabi God. They do it like they are all together in it. And when you see them after the surgery, they started telling me what I should expect. Sometimes surgery could go south, but for my daughter, everything was good.
Zoey is a milestone. And she's a big fighter, and she's been discharged home already because she's gaining weight and she's doing very well.
And was discharged at the weight of 2.5 kg. She has had immunization. She's come for follow-up. She's doing pretty very well. And we're very happy. Mom is very happy. And Zoey is growing.
And I would always tell people, I know that healthcare is not cheap, and excellent healthcare, of course, is not even cheap like normal healthcare. But if you need the best healthcare service, Evercare Lekki is the place to go to.